adequate buffer stocks of various medicines.
Prime Minister Narendra Modi chaired a high-level meeting to review the situation related to COVID-19 and the pace of vaccination. The PM was briefed about the global trends in COVID-19 infections and cases in the meeting that lasted nearly 2 hours. Officials highlighted that countries across the world have experienced multiple COVID-19 surges since the onset of the pandemic. The PM also reviewed the national situation relating to COVID-19 cases and test positivity rates. In view of the rising cases in African countries pertaining to the new corona variant, Omicron, the PM spoke about the need to be proactive. The PM said that in the light of the new threat, people need to be more cautious and they need to take proper precautions like masking and social distancing. The PM highlighted the need for monitoring all international arrivals, their testing as per guidelines, with a specific focus on countries identified as at risk. The PM also asked officials to review plans for easing of international travel restrictions in light of the emerging new evidence. The PM directed that there is a need to increase the second dose coverage and that states need to be sensitized on the need to ensure that all those who have got the first dose are given the second dose timely. The PM directed that genome sequencing samples be collected from international travelers and community as per norms. He instructed officials to coordinate with states to ensure that there is adequate buffer stocks of various medicines. He asked officials to work with the states to review the functioning of medical infrastructure, including pediatric facilities.
आरंभ से ही प्रधानमंत्री जी ने डे टू डे बेसिस पर स्वयं समीक्षा की है और यही कारण है कि कोविड के इस युद्ध में भारत की सफलता विश्व भर में अब कबूल की जा रही है और जिस प्रकार भारत ने सफलतापूर्वक मोदी जी के नेतृत्व में इस आपदा का सामना किया उसके परिणाम स्वरूप आज भारत विश्व के प्रथम श्रेणी के देशों में आकर के खड़ा है.
The World Health Organization has labeled the new COVID variant Omicron that is spreading rapidly in African countries as a variant of concern. India has till now not been impacted by this variant, but the centre as well as several states are all geared up to see that this dangerous variant can be stopped from entering India. Several state chief ministers including Karnataka, Uttarakhand and Rajasthan took review meetings and directed several containment measures in anticipation.
I have called all the experts, Health Department, Disaster Management Department. We want to have a detailed and then we will formulate डिटेल प्रिकॉशनरी मेजर्स.
हमारा पूरा ध्यान है टेस्टिंग को लेकर भी और गाइडलाइन को लेकर भी. हम पूरी तरह से सजग हैं और हम कोशिश कर रहे हैं कि हर प्रकार से जो है उसको रोका जाएगा और जो भी जरूरी एहतियातन जो जरूरी इंतजाम है वो इंतजाम हम सकते हैं.
हमारे यहाँ थर्ड वेव की संभावना व्यक्त की जा रही है पर अभी फॉर्चुनेटली अभी लक्षण दिख नहीं रहे, परंतु पिछले 10 दिनों में जो संख्या बढ़ रही है, राजस्थान में बढ़ रही है और सब जगह बढ़ रही है, वो चिंता का विषय बना हुआ है. तो अभी भी मास्क लगाने की जरूरत बहुत ज़्यादा है जो लापरवाह लोग हो गए हैं.
States that with this international flight movements have increased surveillance on passengers coming from several states. All possible steps have been expedited at the airport as well as at other points to prevent COVID infections.
केसेस और जो व्यवस्था वो दूसरी लहर में थी उससे भी 2.5 गुना व्यवस्था अभी बढ़ा दी है. ऑक्सीजन की बात हो, ऑक्सीजन बेडेड की बात हो, आईसीयू की बात हो, वेंटिलेटर की बात हो, अभी ये तीसरी भी आवे, चौथी भी आ जावे कि 5वीं भी आवे, यहाँ पर कोई फर्क पड़ने वाला नहीं है. सब गुजराती को कोई चिंता करने की ज़रूरत नहीं है.
जो प्रवासी आ रहे उनको क्वारंटाइन किया जाएगा. जो प्रवासी आ रहे उनको जो दक्षिण अफ्रीका हो या दूसरे देश से आते कंट्री से, तो उनको जीनोम सीक्वेंसिंग का चेक करना पड़ेगा. उसके बाद जो हमारे देश में आते तो उनको क्वारंटाइन करके वो सब चेकिंग होने के बाद ही छोड़ा जाएगा.
While with regard to the new variant, the centre as well as state governments have been alert, and on the other hand, corona containment measures already in place are being rapidly implemented. Delhi's Lieutenant Governor Anil Baijal has directed senior officials to ensure that people strictly adhere to COVID-appropriate behaviour in public places and events. Instructions have also been given to ensure that hospitals are fully ready to deal with any emerging situation. With Delta variant having led to problems for European countries and now with Omicron variant, concerns are on the rise across the world in the global fight against the pandemic. Bureau Report, DD India.
Well, the Omicron variant of concern has resulted in precautionary steps being taken by several countries to isolate the movement of to and fro from areas. This is where the virus has been found, and Omicron is a virus of concern because preliminary evidence suggests it creates an increased risk of reinfection. The variant is currently prevalent in South Africa and other African countries. The World Health Organization has classified the B11529 variant detected in South Africa as a SARS-CoV-2 variant of concern, saying it may spread more quickly than other forms. Preliminary evidence suggested there is an increased risk of reinfection, and there had been a detrimental change in COVID-19 epidemiology. It said in a statement after a closed meeting of independent experts who reviewed the data. The new variant has now spread to travelers in Belgium, Hong Kong, and Israel.
Omicron B11529 is named as a variant of concern because it has some concerning properties. This variant has a large number of mutations, and some of these mutations have some worrying characteristics. Right now, there are many studies that are underway. There's a lot of work that is ongoing in South Africa and in other countries to better characterize the variant itself in terms of transmissibility, in terms of severity, and any impact on our countermeasures like the use of diagnostics, therapeutics, or vaccines. So far, there's little information, but those studies are underway.
Meanwhile, countries around the world rush to suspend travel from southern Africa, even as global authorities reacted with alarm to the new variant detected in South Africa, as scientists seek to find out if the mutation is vaccine resistant. Earlier, the WHO cautioned countries against hastily imposing travel restrictions linked to the variant of COVID-19, saying they should take a risk-based and scientific approach. The United States will bar entry to most travelers from 8 southern African countries starting November 29. The travel restrictions do not ban flights or apply to U.S. citizens and lawful U.S. permanent residents. No cases of Omicron have been identified in the United States to date, according to the Centers for Disease Control and Prevention. Canada and Brazil have also imposed similar travel restrictions from southern Africa. Japan said it would extend its tightened border controls to 3 more African countries after imposing curbs on travel from South Africa, Botswana, Eswatini, Zimbabwe, Namibia, and Lesotho. Sri Lanka, Thailand, Saudi Arabia, Russia, and Oman have also announced travel curbs on southern African nations. Australia on Saturday imposed new restrictions on people who have been in 9 South African countries as the new Omicron variant of COVID-19 raises concerns about a further wave of the pandemic.
Effective immediately, anyone who is not a citizen of Australia or their dependents and who has been in African countries where the Omicron variant has been detected and spread within the past 14 days will not be able to enter Australia. These countries are South Africa, Namibia, Zimbabwe, Botswana, Lesotho, Eswatini, the Seychelles, Malawi, and Mozambique.
European Commission Chief Ursula von der Leyen urged member states to activate emergency brake on travel from countries in southern Africa. Britain and EU countries have also introduced travel restrictions within hours of getting to know of the variant.
It is now important that all of us in Europe act very swiftly, decisively, and united. The European Commission has today proposed to member states to activate the emergency brake on travel from countries in southern Africa and other countries affected to limit the spread of the new variant. All air travel to these countries should be suspended.
Meanwhile, South Africa termed the travel restrictions imposed by many countries as unjustified. South Africa's health minister told media that the country is acting with transparency and travel bans were against the norms and standards of the World Health Organization.
The reaction of some of countries in terms of imposing travel bans and such measures are completely against the norms and standards as guided by the World Health Organization.
Hundreds of foreigners in South Africa desperately tried to get back home on the last available flights. Johannesburg's O.R. Tambo International Airport was busy with travelers trying to make it back to their respective countries before borders are shut.
I'm on a business trip. My trip back was supposed to be yesterday, but that was the plan anytime and anyway, so I'm leaving today because the flight has been cancelled yesterday. So I'm flying back, and I'm not really worried. I know I have to go in quarantine for 14 days. That's how it is. There's nothing we can do.
After cancelling the flight, if I arrive in the UK, because I'm quarantining in Frankfurt, if I arrive in the UK after 4 p.m., I have to quarantine in a hotel on my cost for 10 days. So I don't have the money. I don't have the £2,000 to quarantine in the hotel.
Pharma company BioNTech has said it's expecting more data in the coming weeks on the worrying new COVID-19 variant first detected in South Africa that will help determine whether the company needs to rework its vaccine. Pfizer and BioNTech said that if necessary, they expect to be able to ship a new vaccine targeting the variant in approximately 100 days. Amid the detection of a new coronavirus variant and surge in cases elsewhere, the WHO has asked countries in the Southeast Asia region to scale up surveillance, strengthen public health and social measures, and enhance vaccination coverage. Scientists are still learning about the variant identified this week, but the news pummeled global and oil markets amid fears what new travel bans would do to already shaky economies across southern Africa. Newsnight Desk, DD India.